Okay, everybody, good morning, and thank you for joining us this morning for our webinar. I know that the weather in Belfast I'm looking out my window, and it's really quite horrific. So if you're stuck at home, thank you for joining us. If you made it into work, well done. So this morning we're going to be talking about patient care, about how we can actually remove paper from patient care and start to make efficiencies and, of course, bring cost savings as well. And so with me on the line, I have Sarah Clark from Ipswich NHS. Okay, so let's begin. So a few housekeeping items. So we've covered the introductions. You can ask questions at any time. If you look at the bottom right of your screen, you've got a little toolbar. On that toolbar is a question button. And so any time within the conference, you can click that Q&A button, and we'll handle questions at the end of the session. And hopefully we'll get around to them all. And if we don't get around to all of the questions, we can certainly send you an email after the event. And this morning's session should last roughly about an hour, so I hope you can stay with us for the full time. So let's just a quick word about who Kainos are and Kainos Evolve as a brand. So Kainos is based in Belfast. As you can see, we've got offices in Belfast and Dublin, in London and Gdansk as well. It was brought out of Queen's University of Belfast. There's more than 280 of us, all consultant-based, and our focus is very much the health market, but we've also got a strong history within the public sector, the local government sector, financial services as well, with a strong revenue base as well. So we've been around, I think we celebrated so we're now coming up on 25 years old. And in terms of Evolve, Evolve is our branding for our focus on the health market, and there are several strands within Evolve. Evolve Clinical is what we're going to focus on today, so that's the idea of reducing paper, presenting back a clinical interface to clinical users, so it's all about patient care, and our recent customers would be Ipswich Hospital with Sarah on the line today. We've got West Suffolk Hospital, Canterbridge Centre for Oncology. But equally, we've also got Evolve for a corporate setting, so the managing of, for example, HR files, finance files. We've got the Business Services Organisation here in Northern Ireland, the Eastern Health and Social Services Board, as it was here in Northern Ireland, and Great Western Hospitals. And we also offer other services, so for example, helping you to realise your business case for a clinical or a corporate implementation for paper management. And we've got various customers down at the bottom there as well. So just as an introduction, let's talk about, well, why are customers actually looking at going paper-free or paper-light via electronic document management? And the idea is that lots of trusts and lots of hospitals are moving towards an electronic patient record, and that's certainly what the national program was moving towards. However, from our perspective, if you want to get a full view of what's going on with that patient and their general awareness or their general wellness, you don't get a full view of that patient without taking into account all of the paper-based information as well. So if you want to move towards a full electronic patient record, well, if you want full information about the patient, you've got to take the paper into account as well, and that's what Evolve is largely about. It's about bringing in of that paper, making it available online alongside any information that you may be holding within the electronic patient record. And the idea is that once you introduce better control of your information, you get to be a more compliant organization. So you're the clinical negligence scheme for trusts, better control means reduced risks, means less cost on your insurance premiums. And it also helps you to manage and implement the NHS Records Management Code of Practice as well, so making sure that you're retaining your information in the correct format for the correct amount of time, but also that you're also removing that information from your organization at the correct point, so you don't fall foul of laws like the Data Protection Act. You're not keeping information for longer than is absolutely necessary for your business practices. And one of the key drivers that we have at present is the fact that once you introduce good electronic capture and presentation of notes, then it can actually help you to reduce costs as well. So you're no longer shuffling paper and shuttling it around your organization, so you've got less portering costs. For those organizations that are in high cost per square foot areas, so for example a trust in the centre of London, that means that you can start reducing costs just based on pure storage as well. You've got less missed clinics, less missed surgeries when notes aren't available. So notes are always constantly available online at the click of a button. And with further features, for example, the optional electronic discharge module within Kainos Evolve, you've also got the ability to improve your business processes, meeting, for example, the discharge target of 24 hours. So with electronic discharge, you're getting that information out to the right people at the right time, making sure that you meet any mandated targets. So put simply, our view is that if you've got an APR, the true value of that APR can only be realized when the patient's paper record and the trust paper-dependent processes are included in the solution. In other words, if you want to get a fully holistic view of that patient, you take into account everything that's online in an electronic form, plus anything that would have historically been kept offline in paper-based form, bring it into the one interface if possible, so that with one click, a clinician or a carer can get all of the information in one go.